The UT Health East Texas and UT Health Science Center knew over the summer that they would be among the first hospitals to have access to a COVID-19 vaccine. Dr. Tom Cummins, the Chief Medical Officer for UT Health East Texas, spent the intervening months making sure his staff could get through each day while planning for this day. He took a few moments to share his feelings about the occasion and explain what comes next.
Yes, this is a huge day for East Texas. We at UT Health are thrilled to be able to provide the vaccine for our caregivers so that we can start to end this pandemic. Very exciting day.
And what was your feeling as you watched the box roll in and finally get unloaded?
Well, it's just amazing to know where we were 9-10 months ago, unknown disease, not so little that we knew, and then here we are in December getting ready to roll out vaccine. What an amazing accomplishment by the scientists around the world to be able to produce this.
And is there any extra weight or gravity just knowing how bad the spread is right now as the vaccine arrives?
Well, yeah, it's a joyous moment to know that we finally have a weapon that we can start to slow this down for our communities. It's just, there are no words to express how exciting this is and the joy that this brings to me and I think to many across the area. We've got schedules out for people to sign up, so we have times for people to come. We'll be able to do over 300 people a day running through that process, and really focusing first on the people who provide the care, the nurses, the doctors, the intensive care folks that are in the middle of this care all the time. They're the ones that are the highest risk, and we want them to get the highest priority for vaccines starting tomorrow morning.
And then just sort of, as you are able to sign up, come get it?
That's right. So we've got a little bit of a tiered structure so that depending on what kind of work you do within the system determines when you're eligible to start getting your vaccine. Like I said, the first 3-4 days, the first 3 days are all about caregivers that are in the rooms dealing with patients on a hour-to-hour, day-to-day basis.
So what's the logistical planning been like doing dry runs once you knew what the shipment containers were going to look like, what kind of equipment you needed?
Well, we started pulling people together back well before Thanksgiving, starting to have conversations about, okay, what did we think we were getting? Because it wasn't until recently that we knew which vaccine we were receiving. So we started having conversations about, okay, if we're getting the Pfizer vaccine, how are we going to do that? Because as you saw, it's very delicate to manage, and you have to be very time sensitive about the things you do. We have a big footprint in East Texas, so we wanted to be sure we could safely get the vaccine and take care of the vaccine so as many people could get it as possible. And then just start rapidly pulling people together to say, okay, what's the plan after that? How are we going to roll this through? It's been a great partnership between our Arden Health Services and the University of Texas Health System. We've had people from both sides working through this to figure out the best plan. We're very excited and think we have a good plan to get people vaccinated as quickly as possible. Well, we've got a few weeks till we get the book closed. I mean, it's a 3-week run between shots, and it takes another week or so after that to feel like you're vaccinated. So a lot of the things are going to continue to be the same. We're still going to be asking people to wear masks. I'll get vaccinated. I'm still going to wear my mask to be safe. But it's an exciting thing to know that we finally have something that gives our caregivers a whole nother level of protection and feeling of safety. Because, I mean, as you think about what we've been through the last 9-10 months, we didn't know a lot about the virus. There was a lot of fear and anxiety about what the virus could do, and as we've seen, with good reason. And so now that we can offer something to our staff that gives them a level of protection unlike any PPE. There's no PPE to match a good solid vaccine. So it's just a thrilling moment to know that we're starting to turn the corner against this finally.
Is this enough vaccine doses to cover both shots for all your staff? Do you need more shipments?
No, the plan is through the way the vaccine is being distributed, this is our first round. We don't have to hold any back for the next round. As we give this, more will come to supplement those. And so part of our process is after you get your first shot, we'll schedule you for your second one. It no longer has to be exactly 21 days. The FDA and Pfizer have said that you can do it between days 17 and 21, so it gives us some flexibility in getting people in for that second dose, and then we'll continue to roll it out through the area. But yeah, it's supposed to be resupplied for us. Well, it's finally an opportunity in the community to stop the spread. I mean, it's a chance for us to start slowing it down. Our caregivers have been very susceptible to it, and I'm sure that's been part of the spread. So this is the sign that the end of the pandemic is in sight. To me, and it starts with the caregivers. It'll roll out to other people as we go through the next several months. But this is the first real concrete step of stopping the pandemic.